Now, the manufacturer of these controversial scooters expressed confidence in the durability of their product at the time of launch. It argues it has a track record to prove it.
I mean, we've supplied to countries like Tanzania, Malawi, Uganda, with the same type of mobile clinics and mobile ambulances. And if you look at that information, you know, it will show you that the durability of the bikes themselves is quite good. You know, they've got a proven track record, a history behind it. Those countries still order from us, you know, even today. So basically, it's not the bikes themselves have been proven. It's not a new entry to the system. It's things that have been used, that have been proven, that we know they work. So for us as a manufacturer, we are confident about the product.
Now, of course, each of these so-called ambulances came at a cost of 94,000 rand. The company explains exactly what it is that taxpayers got for that money.
The clinic unit comes with a number of kits. It comes with a scale, comes with a baby scale, a couple of bowls, a stethoscope, needle cutter, blood pressure arm thing, and the thing to inspect the ears and eyes and up the nose and all that kind of stuff. This is all kit that comes with the clinic. You get a gazebo with sides that close in, so you can have complete privacy if you want to examine patients. It comes with 2 chairs. The unit also comes with 2 helmets. It comes with raincoats, and it comes with a little hand basin. It comes with trays that lie across here. Hand basin so you can wash your hands and everything. There's water on the back. Yeah, and so it comes with quite a number of items.
Well, after all that fanfare, the Eastern Cape's Bid Adjudication Committee is reviewing the processes followed in the awarding of this particular deal. The DA has asked for another probe into the matter. Joining me now for more on the story is the party's Shadow Minister of Health, Zweli Mkhize, who's live to us from Cape Town tonight. Zweli, are you surprised that this is where we have ended up today?
No. Good evening. And good evening to your viewers. I'm not surprised at all, and that's why we had decided to pose the question to the minister, because when this was launched in June, in last month, you know, those facilities that are now being touted as just simply being glorified wheelbarrows were launched, and they were and they were promoted by both the minister and the MEC as being innovation. And so one of the things is to request a probe from the Human Rights Commission, because we are of the view that it is inhumane to get people who are sick and who are patients into that scooter to be able to be ferried to the nearest facility. Then the second issue is the issue around EMS regulations, because there's obviously a set criteria what patient transport needs to look like. And that is why we've now requested that information from Dr. Mkhize. And it is not a surprise that he's now come out to say that, in fact, they don't meet the requirements. But then the question is, what is to happen to the 10 million rand that has been set aside for the purchasing of these scooters?
So the scooters have already been bought. They are sitting wherever they're being kept in the Eastern Cape. What purpose are they going to serve now? Do you think that they still have a role to play?
So this is the issue, Kathy, because this is a province that can ill afford to spend 10 million rand on superfluous toys, essentially. And now what we've got is a situation where the province is going to essentially have to allow those motorcycles to effectively go to waste, or either that deal is going to have to be cancelled. And that is why it is important that our colleagues in the province are effectively pushing for that deal to be cancelled. They've started already to ask for the report from the Bid Adjudication Committee, so that we can see whether or not this tendering process was also done effectively, because that in itself is worrisome. The fact that the bid specifications were so specific that it was almost virtually impossible for any other company to actually bid for this tender. And so we'll be pushing for that report to be made public so that we can see that all the bid allocation was actually above board. But the minister needs to come out and he needs to make it quite clear to South Africans that they were misled about these scooters.
Of course, the minister was there at the launch of these scooters. He hailed them as being innovative and etc. Do you think that he needs to now, in fact, be clear on exactly why he said that when clearly there wasn't any clarity around half of the things that were being said, especially around these scooters being used as ambulances to transport critical patients who need care to their nearest clinics or to the main roads where we're told bigger ambulances would have been waiting for them?
Absolutely. I think it's not good enough for the minister to have submitted a response to the question. I think that it's very important that he takes the nation into his confidence and he makes us understand what is to happen now to these scooters when in fact they're now sitting in a warehouse somewhere in the Eastern Cape, the very province that is struggling with mounting a decent response to the COVID-19 pandemic. As we speak, where there are hospitals that are sitting without healthcare workers, without PPE, without even requisite ambulances in areas like Nelson Mandela municipality. So now he needs to come out and he needs to say, because from first glance, one could be able to see that no sick patient can be hooked onto a drip on a scooter in rough terrain in the rural Eastern Cape. It's also not good enough for the minister and the Eastern Cape government to simply say, because they have not been able to afford people access to medical services using roads in the Eastern Cape, that they now must be subjected to even worse conditions. It is not the people's fault that those roads are in the condition that they are in.
One of the biggest challenges, and it was highlighted recently by the Auditor General's report, is the lack of consequence management in the country, that there simply are no repercussions for those who loot, for those who are corrupt, and quite frankly would be responsible for giving the sign-off on a project like this, when in fact the actual use and efficiency of it is going to come to almost naught for the people of the Eastern Cape. Who do you think must be held accountable? And in as far as that extends to political leadership, do you think that there are some heads of those political heads in the Eastern Cape that need to roll?
Absolutely, Kathy. I think we've seen far too often that what happens in these situations is that officials are scapegoated, and yet often they are pressurized by political principles for these deals to be made. It's not to say that that's what happened here, but ultimately there is political accountability that must take place. The MEC in the province is ultimately responsible for the procurement of these scooters. Her, in conjunction with the accounting officer, they need to answer. The HOD and the MEC both need to answer. In addition, the Minister of Health, who endorsed that very project, too needs to answer. And so really, we need to start to see, as you've said, consequence management in the country, because now we're sitting with the situation where 10 million rand has potentially gone to absolute waste in a province, one of the poorest provinces in the country, while people are still dying due to this COVID-19 crisis.
What needs to happen now? What are your next steps as the opposition party?
We are still looking for a declaration from the Human Rights Commission, because we want to ensure that, in fact, the province is never allowed to use those scooters for transporting any kind of patient whatsoever, because they are inhumane and that they undermine human dignity. And so we will be submitting that response that we got from the minister to the SAHRC to ask for them that they still make the declaration. But we'll also be writing to Minister Mkhize to ask him to clarify what now that these scooters have been proven to not meet the basic requirements for patient transport. What will happen to the money that the province has spent, and what is his role in rectifying the situation?